Hello guys, welcome back to our pre-recorded lecture series. Charot. I haven't been recording your lectures guys because I was having a hard time with the Loom app, especially dagan kayong bagyo ni Agi and then dili stable ang connection. So I was hoping na bisag karon na unta makalahos sa unta to ko because nakabantay ko tunga-tunga sa video kay mawala ra kong kalit and then mawala ako ang pag-record sa Loom app. So, yeah, hassle kaayo. But I'm very sorry for that, guys. So, yeah, for this afternoon or for this day's pre-recorded lecture, we have the topic pregnancy testing. Okay, so pregnancy testing, um, it involves the test for mga pregnant women. Pero this is not only for your pregnant women. Naasad tay this pregnancy test can also detect some cancers. Okay, so yeah, I hope you have new concepts and I hope na makuanaj ninyo, ma-internalize rin ninyo siya, guys. Because, daghan na kayo. No. This is the third to the last topic na jud, guys. Okay, so we're down to the last three topics. And, yeah, mahuman na jud tawon ang SEM. We'll proceed na jud sa kuan, as a kansempuhon, another challenge na pod sa inyong school life. But yeah, as I'm still hoping na naara Japon inyong vigor to learn new things. Okay, so let's proceed. We have here. So pregnancy testing, what are its clinical applications? Okay, so first, pregnancy testing can be used in the confirmation of pregnancy. Of course naman, no need to think. And the identification of pregnant patients. Of course naman, di ba? Unsa pa man di ay lain. So, another one, we have your diagnosis of ectopic pregnancy. Now, ectopic pregnancy, this doesn't mean ectopic pregnancy usually means that this is a pregnancy happening outside of your uterus, okay? So kaning ato ang pregnancy testing, it helps to diagnose this. So for example, pregnancy outside the uterus, we have especially sa ato ang mga what do you call this? Katong mga PCOS nato ng mga patients, ang usual jud na mahitabo sa ila magka-pregnant sila in the fallopian tube. Okay, so the zygote usually happens, or the zygote usually what do you call this, mature in the fallopian tube. Okay, next we have your evaluation of threatened abortion. Okay, so katuning mga abortion na bag-urang nahitabo, or what do you call this, kanang mga possible abortions to happen samot na sa mga mommies na dili pa ready sa kuan mo commit, di ba? Okay? Next, we have your diagnosis and treatment of trophoblastic tumors. Now, one thing you have to take note is that trophoblastic tumors, trophoblastic means it arises from your placenta. Okay? So, kani siya guys, kaning mga trophoblastic tumors nato, they release HCG, which I will explain later on. Okay, so one thing you have to take note is that trophoblastic means from the placenta, and then these tumors also release your HCG. Next, we have your evaluation of non-trophoblastic tumors. Okay, so non-trophoblastic, wag nang mag-isip, charot. No need to think. This means na wala siya sa placenta, of course, pero will still release HCG. Okay, so example, we have your trophoblastic tumors, maybe testicular, choriocarcinoma, teratoma. Example, ani sa imong teratoma, growth, naatay growth ng mga extra hair or extra teeth, okay? And then we have your seminoma, hydatidiform mole. And then non-trophoblastic daghan pod natay lymphoma, leukemia, cancers of the breast, adrenal cortex, kidneys, and other carcinomas. Okay, except for the skin. Now, we proceed with our test analyte. Of course, we test for your HCG or your human or your human choreo I wait human chorionic gonadotropin. Okay, all right, one more time. You know. Uy, ano na? Okay, okay, last na dyan eh. Human chorionic gonadotropin. Okay, kana. Tongue twister. Charot. Okay, so your HCG, so it is a glycoprotein composed of your alpha and beta subunits. So we have here an example of your what do you call this? Your HCG. Now we have your alpha unit and your beta subunit. Now one thing you have to take note is that the alpha unit is identical with your other hormones, okay? So other hormones include your luteinizing hormone, your follicle stimulating, and your thyroid stimulating hormone, okay? So kay kuan man common man imuhang alpha subunit, what we use to test is your beta subunit. Okay, your beta subunit is tested because it is more unique. It is unique per hormone, and yeah, it is more specific. Or rather, it confers your specificity. Okay, I hope that's clear. Next, we have your first detected shortly after implantation of the zygote. So, basin mga pila ka hours or, days o sa ma-detect ang imong HCG. And then it is usually found in your urine, blood, amniotic fluid, your colostrum milk. So, moni imong colostrum milk is your first milk to be released from a pregnant mother. So, kaning colostrum milk is very important for your fetus because diri daghan kayo mga nutrients and mga other kanang mga antibodies na naa si mother na pwede niya ma-pass down sa iyang baby. Okay? And then we have your fetal tissues and nearly all body fluids of a pregnant woman. Okay, so we test HCG because its primary role is to keep your corpus luteum, from degenerating or kanang to keep it functioning. Kay kuan man, your corpus luteum releases or continues to produce estrogen or pwede sad estradiol and progesterone, which are needed for your pregnancy. Okay. Next, we have your HCG is made by cells formed in the placenta. Okay. So, specifically in your syncytial trophoblast. So, let me just write that pen. Okay, I'm back with my board notes. Oh my gosh. Guys, that is syncytio, guys, ha? Syncytio. Okay. Syncytio trophoblast. So, i-attach ninyo ning trophoblast. So, ang spelling ala kay SYNCYTIO trophoblast. Okay? So, oh my gosh, may tag-clear na siya, guys. Oh my God, di siya makita. Okay. So, ako sa nang i-erase. Okay, so levels of your HCG can be detected by a blood test about 11 days after conception and about 12 to 14 days after conception by a urine test. Okay, so typically the HCG levels will double every 72 hours, and then the level will reach its peak in the first 8 to 11 weeks of pregnancy, and then will decline a level off for the remainder of your pregnancy. Now, remember HCG levels will peak in the first 8 to 11 weeks or your first trimester. Okay, first trimester, 8 to 11 weeks, highest peak. Okay, next we have your different methods of pregnancy testing. We have your bioassays, which uses your live animals. We have your chemical pregnancy test. We have your clinicians or your clinical pregnancy test. And last, we have your immunoassay. So, diri na mo insert tong atong mga test kits, which are usually performed na sa mga routine labs. So, One thing you have to take note is that immunoassays are more convenient and are easy to perform. Now, another one is that bioassays, are obsolete, not usual, not performed na gyud sa lab. Okay, let's proceed with your bioassays. Now, bioassays entails the use of laboratory animals. Okay, it uses live animals, Jude, guys. And then samples are injected and positive reactions are noted. Okay, so these tests are very what do you call this? Are very invasive. So medyo dili siya safe sa animal. So luoy kaayo animal cruelty ni siya. So that's why it's good na obsolete na ni siya. Kay imagine na naa sa lab, naamo sa internship mo niya. My gosh, magkuan-kuan pa mo animals, di ba? So yeah, during our third year, makalingaw na makasad ni siya na activity, which I will chika on later. Charot. So we have your classic pregnancy bioassay formats. We have different types: immature female mice, immature female rabbits, immature female rats, frogs, or toads as test animals. Okay, so take note, bioassays are invasive, obsolete, not performed in your routine lab. Okay. First, we have your immature female mice as test animals. So this is what we call your ISHM zone deck. So we use your immature female, okay, and then we inject 0.4 ml of urine from your patient. It is injected subcutaneously to your dorsal limb. So I think that's somewhere here. And then incubation period, medyo taas-taas siya, guys. So this is not convenient good. So 100 to 120 hours. Positive is your enlargement of ovaries. So yeah, it's quite, invasive because mo inject mo. And then I think for me, we need to cut open your mice to see whether positive ba, nagka-enlarge ba ang ovaries or wala. Okay? So presence of red spots in your ovaries, we have your corpora hemorrhagica. And then presence of yellow spots, we have your corpora lutea. Okay? Next, we have your immature female rabbits as test animals, diba? Cutie. Next, we have two types. We have your Friedman's test. So we also use your immature females. Kanisha, 15 ml of urine is injected to the marginal ear vein. So somewhere here. And then incubation period is around 30 to 48 hours. Whereas we also have your Hoffman's test. Ang iyahang difference is that it uses 5 ml of serum. Okay? So, kagaya ng just like your Friedman's, it also uses your immature females, and then 5 ml of serum to your marginal ear, 5 ml serum, 15 ml urine. And then incubation period also around 30 to 48 hours. So positive result is your hyperemic uterus. So we define hyperemic as something na mo-increase bitaw ang blood flow. So, in this situation, hyperemic uterus, so mo-increase ang blood flow sa uterus sa imuhang rabbit. So, I think this also incorporates, opening up your rabbits na atay makita dito na basin mag-red or something na mag-swell ba ang iyahang uterus. Okay? Take note, Friedman's 15 ml urine, Hoffman's 5 ml serum. Alright, next we have your rats as test animals. We have your Frank Berman's test. So, di ba sa Ratatouille? Charot. Dayon, it also uses your immature females. 5 ml urine is injected subcutaneously, and the incubation period is around 16 to 24 hours. Whereas we also have your Kelso's test. So also incorporates immature females. Kanisha, 4 ml urine is used. Incubation period is around 24 hours. So take note, Frank Berman's sa imuhan ni siyang rat, 5 ml, and then Kelso sa imong rat, 4 ml. Okay. Now, your positive reaction, hyperemic ovary. So, hyperemic, strong or kusog, increase blood flow to your ovaries, which I think will also we will also need to open up or slice your rats, diba? So, luoy kaayo ang ato ang mga animals ani, okay, this is not cruelty free, good. And then lastly, we have your Copperman's test, also use your immature female. And then 4 ml urine is injected intraperitoneally, so I think yeah, somewhere, yeah, di siya makita, somewhere there. And then incubation period is around 20 to 24 hours. Positive reaction is your, again, hyperemic ovaries. Next, we have your, what we, kani siya, wala mi ka, kuan ani, ka perform, unsay tawag ani, na frog, nganong murag creepy kayo siya mata, murag, it's like staring into your soul and judging you. Charot. Charot. Okay. Now we have your frogs or toads as test animals. We have your Hogben's test. So it uses your female African clawed frogs, your Xenopus laevis. So procedure, we set aside your frogs from 8 to 12 hours, and then we inject your 2 ml urine from your patient to the dorsal lymph sac, okay? And then we incubate for 8 to 12 hours. The positive reaction is your oogenesis, or production of eggs, or mu-ovulate imuhang, what do you call this, imuhang frog. So take note, female guys, a female African clawed frogs, okay? Now, nganong ako tong gipa-take note? Because in the next one, male na ni siya atong ginagamit, okay? Now, we have your, mo ni siya atong i-perform unta sa ato ang lab, pero sadly, yeah, wala jud, makasad lang, ha. Kuan ta to ni siya, nice unta to ni siya na experience for you, pero for those kanang mga die-hard animal lovers, medyo kuan ni siya, traumatizing na, what do you call this, traumatizing na experience. So we have here your different kinds of frogs, your Rana pipiens, Rana clamitans, Bofo, and your Bofo americanus. So daghan kaayo ni siyang Bofo and your Bofo americanus. Mo ni siya ang ato ang usual na makita jud diri. Okay? So take note ha, male ni siya guys, ha, male. So far, mga female to na mga test, mga female to na mga animals atong ginay-use. Pero for your Galli Myninis test, we use your male frog or toad. Okay? Okay, mo na siyang gingon. So next, we have your procedure. Inject 2 ml urine to the dorsal lymph sac. So, mo ni pud another reason pud nganong kanira pud atong ginagamit sa ato ang lab unta for, educational purposes, kay 30 minutes ra iyahang incubation period. 30 minutes to 3 hours. And then collect urine samples from the cloacal opening of the frog. So, di ba? Yeah, medyo sakit and medyo luoy kayo kay sa butthole sa frog ini mo siya i-collect, okay? So place 1 drop on a slide and then place a cover slip and examine microscopically. So its positive reaction is spermation, or your creation of sperm. So balik ta sa ato ang guys, balik ta sa atong previous slide. So yeah, it's the procedure is quite, sakit siya for the frog because magamit man gud pasture pipette guys, di ba? Ang katudjong hole jud na unsa na tip, ay dili jud hole, pero katudjong sa tip bitaw sa katong nay opening sa imong pasture pipette, moto ang isulod sa ilahang cloacal opening or sa ilahang lubot sa ilang butthole. So yeah, if for example what do you call this, we need the urine manggod or the sa imong male. So naay times na pagpasok nimo sa unsay tawag ani sa pasture pipette, naay mo gawas dayon na kanang murag liquid. And then pero naapoy times na kailangan pa nimo i-tickle ang frog, i-tickle nimo ang frog sa iyahang belly, or one traumatizing event good guys, like as like na experience yun naman sa third year. Okay, di ba? Kamo man mga students mo mukuha or mo collect sa imuhang frog. So kamoy kuan dito manguha dapit sa easy, and then yeah, dapat dili nimo siya i-agitate pag-ayo kay kuan mo na siya ang akong traumatizing experience ani guys kay naabot bitaw sa point na gadugo na ang cloacal opening, like ang salubot sa ang sa frog luoy. Luoy kayo ang frog guys kay ang giingon magud kay murag i unsa na isulod, igawas isulod, like in and out na mo ang unsay tawag ani, in and out na mo ang pasture pipette. So naay uban guys na murag kusog kaayo ilang pagkahimo bitaw ana. So luoy ka, gadugo na ang kuan frog. So sa akong classmate to, so that was very kuan jud guys, traumatizing gyud, like as in ga flow na jud ang dugo. I don't want to talk, I don't want to kuan dwell on it anymore kay yeah, that was very traumatizing. And yeah, wala ra, charot, basta maura to siya guys, maura to siya akong cheka. Okay, so okay, remember na we must place 1 drop sa imuhang slide sa from the urine sa frog, from the kuan unsa na urine sa frog, and then we examine for your spermation. So mo ni siya ang injection of urine sample sa imong patient into the dorsal limb sac, okay? And then the next one mo ni siya ang characteristic na banana shaped sperm sa atong mga frogs, okay? Take note, banana shape guys. Okay, banana shape. Wow, naday highlighter. Banana shape ang atong sperm sa frog. Okay? Alright, so before tamo proceed sa false positive ani, please remember na kani siyang mga bioassays nato not are obsolete, again, are obsolete, are invasive, and not performed in the laboratories. Okay? Next, we have your causes of false positive reaction. Now, we have your high titers of your pituitary gonadotropin or your PG because it has the same structure. And then we have your drugs such as your chlorpromazine derivatives or your compazine, your phenothiazine derivatives, and your aspirin because it can also cross-react with or it can cross-react or can also stimulate the production of your HCG. And then we also have your ovulation induced by handling kay basin as what I've said, dapat dili ma-agitate ang atong frog kay basin niya makahimo na noon sila og HCG bisag dili unta to intentionally. So another thing is that basin ma-stress ang atong frog, okay, sa pag-handle sa examiner. Next, we have your spermiation induced by epinephrine in the urine. And then we have your incomplete abortion. So, there may be small quantities of HCG present sa ato ang urine which resulted to the production of your false positive result, okay, sa imong HCG. And then again, your trophoblastic tumors from your placenta. Alright, now next we have your causes of false negative. So, low sensitivity of test animal due to seasonal variation. So, pwede na wala ka produce si animal ani kay basin padulungay nag-hibernation, ani nakuan or unsa ba. So, yeah, it depends. And then your low titers or concentrations of your HCG can be because kuan pa ni kanang nag-collect si patient during pa sa mga first few days or first few hours of pregnancy. So to correct this, we concentrate by extraction or absorption with kaolin. Okay, take note, kaolin. Dayon, next we have tsada kaayo pagka-highlight. Okay, kaolin. And then next we have your toxic specimen. So, mo siya usually from your dialysis patient. So, yeah, ang remedy ani is to detoxify by your dialysis, of course. And then your alkaline urine due to bacterial contamination. Kaya diba mo thrive man ang bacteria sa alkaline pH. And then we correct this by acidifying using your HCl until pH 6. So, this is also to maintain the integrity of your HCG. Okay, now we have your causes of toxic urine. You have excess amounts of electrolytes, particularly your potassium, bacterial contamination, and toxic substances. We have your presence of salicylates and barbiturates. These are a type of medication. Okay, as what I've said, these may cross-react with with your HCG to produce HCG. Okay. All right, now we have your chemical pregnancy test. Okay, first we have your pregnanediol. Okay, pregnanediol. So the substances tested is your progesterone or your pregnanediol. Okay, so when we say what do you call this? Chemical pregnancy test. These are usually colorimetric or usual na to ang ginalantaw ani or ginalook out after is your changes of your color. So we have you so urine plus a few drops of your reagent. So the positive color is a deep orange or dark brown color. So as what I've said, chemical pregnancy test, colorimetric reactions ni siya guys ha. And then, mora na siya. Itong i-take note ang changes of your color. Whereas we have your Lugol's iodine test. Okay, so ang substance tested is your epinephrine or your adrenaline. And then urine plus a few drops of your Lugol's iodine. And then, mo ni siya. So we have your, we have your deep orange color. So, as you can see here, medyo same medyo sila o positive reaction dili ra mo mag lisod og memorize ana. Okay? Next, we have your clinicians or your clinical pregnancy test. So, what we have here is your prostigmine withdrawal bleeding test. So we inject your reagent with which is the neostigmine or your prostigmine subcutaneously. So the positive so the reactions include your no bleeding in pregnant women and then bleeding in non-pregnant women. So kanisha guys imohang prostigmine, it is by injection. So ang iyahara yung whole point ani guys is kanang mo stimulate og menstruation. Okay, it stimulates menstruation. So of course if pregnant ka dili jud ka magmenstruate, so no bleeding jud siya guys. Whereas if kuan ka, if dili ka pregnant, of course magmenstruate ka na. Okay, so these are not usually performed pero gina-perform pa pero not usual or not routinely performed, unlike your bioassays na murag phase out na gyud. Okay, so kani siya this is for people with abnormal menstruation cycles. Okay, so pwede diri ato ang mga PCOS patients or any female na kuan abnormal ilahang menstruation cycle. Okay, I hope that's clear. Next we have your immunoassay. So bear with me guys, medyo lisod-lisod ni siya i-explain kay dagan kay mga new concepts and new terms to take note, pero yeah, I do hope na mag-grasp ra ninyo ang or I'll try my best na ma-explain nako siya kanang murag in a dili kaayo technical na way kay this will be further discussed manggod sa inyuhang IS. Okay, next sem, OMG, next sem. Excited na mo guys. Go, excited na ko. Chat. Okay, we have your radioimmunoassays. So, radioimmunoassays meaning it uses your radioisotopes. But these radioisotopes, guys, these radioisotopes are not limited or not restricted to pregnancy testing. Okay, dagan kayong mga test na mo imply or mo gamit aning mga radioisotopes. Okay, so recall we detect ato ang gina-find out is your beta subunit assays because unsay tawag ani your beta subunit is much more specific than your alpha. Okay, your alpha subunit is more more common. Okay, so your beta subunit assays uses anti-serum against the beta subunit of HCG. Okay, so yeah, one thing na chika po di guys. Let me just get my pen. So, ang usual na ginagamit nato na radioisotope is your iodine 125, okay? This is your iodine 125. So, muna siya ang usual gina-imply sa mga laboratories, okay? All right. Now, we can also use your whole molecule assays. So whole kuan na dyan siya guys, whole HCG. So both your alpha subunit and your beta subunit. Okay. So just a quick side note, most specific, use beta subunit. Most sensitive can detect at this level 0.005 IU per ml, and then it is the most expensive test. Okay, so yeah, as let's just recall your terms sa inyohang ClinChem specific. It only measures the analyte of interest. Sensitive, it tests the analyte na kanang unsa na smallest concentration of your analyte, and then most expensive siya guys kay yeah, it uses radioisotopes man good. Okay, so next we have your agglutination test. Under Japanese siya sa what do you call this, immunoassay. So when we say agglutination test, it usually incorporates your antigen antibody complex. Okay, basta agglutination test, antigen antibody complex. Okay, now antigen mo ni siya ang imuhang foreign substances na not part of your body, pero dili siya salikay na kay antigen guys ha, mo elicit na og immune response, dili. Okay, basta kuan na lang inyo jung i-take note, antigen, foreign substance not part of your body, antibody of course body na siya sa imong body. Okay, now yeah. Okay. So we have your direct latex agglutination test. One thing you have to take note is that kaning latex na to guys, it is manufactured rajud, like it is made in the laboratory or sa ato ang mga manufacturers. Okay. So ako sa ning i-present ninyo. Okay, so we have your principle, your reverse passive agglutination. So we have here your HCG from the patient. Wait ha. Kuan na lang guys, ako na lang iingondaan na basta direct agglutination guys, it detects something that is not in your body. Okay? So, kuan, direct di siya mismo na kanang naa na siya daan sa imuhang. That is in your body guys, that is in your body. And then, kani, the passive agglutination means that this substance, okay, the substance found in your latex particle are your antigen, okay? Antigen. Oh my God. Antigen na siya guys ha? Kanina lang. Antigen. Basta passive agglutination, ang naa sa latex is your antigen. Pero, reverse man siya guys. Reverse man siya. So, ang kuan, therefore, ang antibodies na ang naa sa imuhang latex instead of your antigen. Okay, I hope clear ato. So, yeah, again, ang if passive rigid guys, passive agglutination, ang latex particle which is from your manufacturer, ang naa niya, ang attach niya is your antigen. Pero kani, it is reversed. So, ang latex na noon, ani niya, ang naa sa latex nimo is your antibody. Okay, so I hope that's clear. So, we have here your HCG from the patient, and then we have your latex particles with your anti-HCG, okay? And then it cross reacts, therefore naatay mga kumpol or your mga visible agglutination, okay? So again, we detect the HCG in the urine, and then we add your antibody which is coated, this is your, what do you call this? This is your antibody coated with your HCG, okay? Yeah, so in this case, the HCG becomes the antigen. So ani ra na test guys ha, ani na test, the HCG becomes the antigen. Okay, and then of course si HCG nimo naman tay antibody diri for HCG, of course mo combine jud na siya, mo combine jud na sila. Okay? Therefore, naatay mga visible agglutination or mga kumpol-kumpol or mga lattice. Lattice formation. Okay? Pero if ever guys, walay HCG, so walay mabindan, walay mo attach sa tong latex particles, of course, walay agglutination na mahitabo. Okay? So I hope that's clear lang jud guys. So positive, of course, we have your agglutination. Negative, we have without your agglutination. Okay? So may tag nakasabot mo ato guys basta ha. Direct agglutination detects something that is in your body. And then we have your passive agglutination, means that the substance found in the latex particle kay imuhang antigen, pero kani kay reverse man. So ang substance na naka-attach sa imong latex kay imong antibody. So mo ni siya in this sense, in this test, HCG ang nahimo nimong antigen. So kani siya naatay antibody daan sa imuhang latex na naka-attach. So naamay HCG si patient. So mo na siyang mo bind siya diri, causing your lattice or your agglutination. So may tagkuan na to siya guys, carry bell sa to. And then we have your indirect latex agglutination inhibition test. Okay, so the principle is your neutralization. So we have here your HCG from your patient. So and then we add your anti-HCG. So of course, naamay HCG si patient, and then naamay HCG, so mo react siya sa what do you call this, sa antibody against HCG. So mo ni siyang muhimog complex formation. And then inhibition man siya guys, so mo add ta og mga latex particles with HCG. So therefore therefore ang mahitabo na noon ani guys, wala nay agglutination. Okay, kay nganumang walay agglutination ma'am, kay ang mga HCG diri, ang HCG sa patient na use up naman sa ato ang antibody sa first reaction sa imuhang anti-HCG. So nahimo ng complex, nahimo na siyang kanang nagbind na siya. Okay, so pag-add nato sa latex particle with HCG, so for example, we have your test tube, we have your urine here, and then muad tag serum na siya guys, serum na naa ni siya in the first reaction. Okay, and then next na pod muad na pod ta og kanisiya, muad ta aning latex particles with HCG. So of course na-use up naman ang HCG kay ni-combine naman siya diri sa imuhang antibody na anti-HCG. So wala na'y mariakan, wala na'y mo attach ani sa mga binding sites sa imuhang latex particle. So of course, no agglutination. Okay? So positive reaction without agglutination. Okay, bali ni siya guys sa without kay of course neutralization. Basta neutralization, inhibition, iha yung positive ana guys kay without agglutination. And then negative with agglutination. Okay, kay nga numang with agglutination. So for example, wait, ako sang i-erase ha. So for example, wala ato ang HCG. So kaning ato ang mga antibody, kaning antibody against HCG mo attach na noon ni siya diri sa ato ang latex particles with HCG. Okay? Okay, mo na siyang mahimo siyang with agglutination. Okay? Kay wala man na use up ang antibody nato diri. So, yeah. I hope that's clear. If you have any questions, guys, please ask jud nako. Okay, I know this can be quite tricky, Jude. I'm having, to be honest, I'm having a hard time explaining this na kanang pang beginner kay, mahina talaga ako dito, guys. Like, mahina ko ani na topic, pero that's the simplest explanation jud akong mahatag, guys. May tag magets sa jud ninyo. Hopefully praying na magets sa ninyo. Okay, so take note: inhibition test or neutralization, no agglutination. Okay. Whew. All right. Now we have your labeled immunoassays. So we have here your one-step pregnancy test. Okay, mo ni siya ang ang usual na tong magamit sa lab kana. This is makita rin nato sa mga unsay tawag ani kanang mga point of care testing, just kanang mapalit nato sa mga pharmacies, sa Watsons, o di ba? Watsons lang malakas, guys. So, yeah, mga kuan na ni siya katulad ning mag-drop ta og urine, pero dili ta magkuan ha, mag-assume kay lisod medyo lisod pud ang principle behind this test, okay? So yeah, you ready, guys? Let's get it. Charot. So mo ni siya. Ang procedure nato, number 1, bring the sealed pouch to room temp. Of course, we need to bring it to room temp for it to optimize ang ato ang reaction. And then open the pouch, remove the test device, and place it on a flat, dry surface. And then holding the urine dropper, kay usual majud na urine dropper along with this, squeeze 3 to 4 drops of urine into the urine well. And then as the test begins to work, a purple color band will move across the result window in the center of the test device. So, one thing you have to take note is your color band, okay? Mana siya mo indicate if positive ba or negative, okay? And then interpret the results at 3 minutes. 3 minutes, okay? Pero depende ni siya sa test kit, guys. Na yung ubang test kit na good for 2 minutes na your resulta, okay? Pero as our educational purposes, unsa na kanang unsay tawag ani? Kanang para uniform na lang, okay, go. Para uniform na lang atong understanding, 3 minutes ra atong gamiton. Okay, principle your immunochromatography, okay? So, yeah, so after reading this, guys, okay, reading assignment na siya. So, di rin ako sa explanation part. Let's go. So, we have here your mokunani ang inyuhang test kit. Okay. Now, muna siya ang assay direction. So, diri ka mo butang og sample katong 3 to 4 drops, and then padulong diri ang imuhang what they call this? Ang imuhang reaction, okay? And then we have your GOAT anti-HCG for your test for your test band. And then we have your GOAT anti-mouse IgG sa imong control. So, mo ni siya HCG from the urine of the patient. And then we also have your mouse anti-beta HCG monoclonal antibody or your gold-colored conjugate. So, so mo ni siya, guys, kani siyang mga animals, kaning goat, mouse. This differs, okay? Depende na siya sa manufacturer. And then, this goat, kani siya, guys, what do you call this? Goat anti-HCG is from your goat, of course. So, we inject HCG to create antibodies sa imuhang goat. And then, kani siyang mga antibodies which will be extracted. And then, mo ni ang ginagamit na to diri. Okay, so, how do I explain this? So, so kani siya, guys, mo ni siya diri ang test well nato. So, HCG from urine, okay? So, inside the test kit, we have some antibodies, okay? O antibodies waiting for your HCG. So, waiting rin sila, guys. Patiently waiting silang mouse nimo. And then, pagkahuman nila bind, ani nila, guys, kay na may HCG, pagkahuman nila og bind, mupunta na sila diri sa imuhang test band, which is composed of your GOAT anti-HCG. Oh my gosh. Also, wait. Okay. Which composed of your GOAT anti-HCG. So, kani siya tungod kay naa pa may binding sites imong HCG, naa pa siya kanang murag free binding sites, mo bind na siya sa imuhang goat anti-HCG. So maunang makakita ka na naay linya sa ato ang ay wait, usbon ako na siya color. Asa ning color ani? Walay color. Ay, ink color there. Okay. So, mauna siyang natay makita dira na purple band sa imuhang test band kay naa may HCG si patient. Whereas kaning control nimo, your control band, this will serve na to catch your excess mouse anti beta HCG. Okay, kay di ba mo flow man sila padulong diri. So naa may mga excess mahitabuan ni kay di man jud tanan mo bind sa imong HCG, mapunta na siya, mo bind na siya sa imuhang control kit, sa imong control band, sa imong control band. So maupod nang mo color pod na siya diri. Kay this control band will serve as your unsa tawag ani kanang murag quality control na kani siya na unit mismo kanang nagwork pa japon siya or dili siya expire or kaning resulta diri sa test kuan siya kanang legit siya. Okay, so pang quality control ni imong control, of course kay control man siya. So yeah, murag mauna siya, guys. So okay, again. So sa test band naa gawait na formation, so sila gawait po ni sila sa formation ani nilang duwa. Okay, so maglahi na ko color. So di ba kuan magwait sila si test control band and si control band sa formation ani nila duwa if example jud na HCG. Okay, so mag-wait sila sa formation nila, and then pag-move nila towards the kit, okay, ma-collect ni siya na formation sa imuhang test band, and then the excess na wala mo bind diri sa imong HCG kay basin daghanon ni siya na amount, ma-capture sa imuhang control band. So maunang mo positive pod apil ang imuhang control pad. Okay, so I hope tricky kayo ni siya na topic, guys, pero promise makuan ni siya mag-gets ninyo ni puhon sa inyong second sem sa sa inyong IS. Okay, this will be explained further, pero I hope na-gets ninyo na. Sige. So interpretation. Okay, we have your positive duwa ka line ang ni positive. So one for your control and one for your test kit. So meaning ang unsa tawag ani ang katong mga mouse nimo, they are working correctly, therefore sakto ra pod ang kuan kanang naa-joy HCG si patient sa iyang urine. Negative is ang control ra mo'y naa, okay? So meaning sa test nato walay HCG sa urine sa patient, okay? Muna siya negative. So ang mga invalid, guys, we have two options here. Ang una, ang test ra na kuan mo'y ni unsa tawag ni ang ni positive or na ni hatag og line. And then kani wala joy line na hitabo. So dapat jud, guys, ma-consider siya invalid basta kay walay wait, ako sang i-erase. Basta kay walay line sa control nimo. Okay, so very important jud na control line, okay? Para to consider na your test kit is still working. So for example, mo ni mong mahitabo, so you get another test kit, and then you do the test again, perform the test again. If same ra japon ang nahitabo, ang test ra japon ang ni color and wala sa control, meaning the whole package or the whole kuan kanang katusya na na mga test kits mismo is expired or na ay something wrong ato. So you have to do quality control, meaning i-replace nimo to sila, ilabay nimo to sila kay di naman to needed. Okay. Okay. Next, we have your causes of false positive results. We have your increased titer of your luteinizing hormone at mid-cycle peak and menopausal period, because I've murag naatoy ko naatoy ginaingon na ang beta sub unit of your HCG is very similar man good sa imong luteinizing hormone, pero ang beta subunit ni HCG nato guys is much more larger, okay, is much larger compared to your luteinizing hormone, okay, and then increase intake of aspirin because it can maybe it can cross react, and then we have your drugs kani kay can cross-react pod also, or basin mo na noon ay makapatrigger nga nung mo produce og HCG atong body. So, of course, your trophoblastic tumors and your non-trophoblastic tumors. So, we have your sa ilang trophoblastic tumors, guys, for example, ang mga male patients nato, guys, ang mga male patients nato na magka-positive bitaw ilahang pregnancy test, this can be due to the patient or the male patient may have a testicular cancer. Okay, you may have your testicular cancer or your testicular choriocarcinoma. Okay, so bantay-bantay lang jud ta guys sa mga male patients nato. Okay, especially kanang dapat kanang naato ko nakita na video sa una sa Facebook, nag-tripping sila ng mga friends, so a group of friends, male group of friends, and then wala ra nagpalit-palit sila sa Watsons guys, and then nagtest sila for pregnancy test, and then among those 5 people naiusa didto na ni positive siya, and then it was later found out na kuan jud to kanang unsa tawag ni the boy was suffering from unsa na kanang imuhang cancer. Okay? Then proteinuria of greater than 1.0 gram per 24 hours. All right, and then we have your false negative. So of course associated with low titer and then early pregnancy, because levels of your HCG in this area are still low. Okay, so quite understandable. We have your ectopic pregnancy, so outside of the uterus, pwede sa fallopian tube, so walay HCG or gamay or walay HCG na release kay wala man sa uterus na hitabo ang pregnancy. So we have your threatened abortion and your alkaline urine, and lastly your toxic urine. Okay, so that ends our topic. That ends our discussion for your pregnancy testing. So I hope you learned something, guys, even though medyo libog ang pagka-discuss nako, pero I'm still hoping and praying na naara jud tawon mo'y nakuha na important ani na ato ang pre-recorded lecture. Okay, so again there are different ways to detect your pregnancy. Okay, so naatay mga bioassays, katong mga immunoassays, mga katong chemical ways, and your katong clinicians ways. Okay, so again, bioassays not anymore incorporated or sa atong mga labs because it is only solely for educational purposes, and then ang usual na to ginagamit is your one-step pregnancy test because it is more convenient, more affordable, more easy. It is easier to use. Okay, and then in a nutshell, pregnancy testing is used to detect pregnancy and to detect your cancers. Okay, so that is all for our pre-recorded lecture in today's topic, pregnancy testing. I hope you understood the topic well. Okay, and then if you have any questions, guys, please feel free to message me. Okay, message me with your concerns and your and your queries. Okay, so hapit na jud ta mahuman, guys. We only have around 2 topics na lang jud, and then yeah, it's the end of the semester. So I hope, please, I hope na you take care of yourself. Okay, please do take care of yourself, drink lots of water, and wag pabayaan ang ating kalusugan. Charot. Sige, so I'll see you guys in our next pre-recorded lecture. Bye bye.